I'm Sarah Serb, a certified nurse practitioner and advanced practice provider in pulmonary medicine at Summa Health. I'm here to talk to you about chronic obstructive pulmonary disease, commonly known as COPD, and the action plan for what to do if you experience a COPD exacerbation. Chronic obstructive pulmonary disease, or COPD, is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. It includes chronic bronchitis and emphysema. The most common symptoms include shortness of breath, cough, sputum production, and wheezing. The most common cause is smoking. Other causes include genetics or environmental irritants such as dust, fumes, and toxins. A pulmonary function test, or PFT, will confirm a diagnosis of COPD and determine the severity of the disease. COPD is a progressive disease, meaning that there is no cure. However, symptoms can be controlled and progression can be slowed by developing and following a plan with your pulmonary provider. Even with compliance to a plan of care, including inhalers, breathing treatments, oxygen, and routine exercise, patients with COPD are at risk for exacerbations or flare-ups, which can complicate underlying COPD and decrease the quality and quantity of life. These can be triggered by respiratory infections, including viruses or bacteria, weather changes, inhalation of irritants, or even just the progression of underlying disease over time. Common symptoms to watch for during exacerbations include increased shortness of breath, more frequent cough, sputum production, including an increased amount or change in color, and increased wheezing. An action plan will prepare you to identify some of the early warning signs of a potential problem, how to take action on your own, and when to reach out to your provider. The action plan that we use at Summa Health consists of zones. If you are in the green zone, it's all clear. Your symptoms are under control or at baseline. At this point, you should continue the plan of care developed by your pulmonary provider, including continuing maintenance inhalers, supplemental oxygen, if prescribed, activity as tolerated, eating a healthy diet, managing stress, and avoiding triggers. If you are in the yellow zone, you should take caution as your health may worsen. Symptoms at this point may include increased cough or sputum production, increased shortness of breath, increased wheezing, increased fatigue, restlessness, or anxiety, or an increase in the use of rescue medications. At this point, there are some steps that you can take at home for relief, including increasing the use of rescue medications, such as using your inhaler or nebulizer every 4 to 6 hours as needed. You can also practice pursed-lipped breathing exercises. You should monitor your pulse oximetry to maintain greater than 88%. If you are already on home oxygen, it is okay to increase by 1 to 2 liters of oxygen to maintain pulse oximetry greater than 88%. If your symptoms do not improve, a call should be placed to your pulmonary provider to possibly prescribe rescue medications such as prednisone, which are steroids to help with inflammation, and antibiotics if an infection is suspected, for example, if you have a fever or change in color of sputum. Your provider may also assist you in scheduling an office or virtual visit prior to further treatment. If you are in the red zone, this means that you could be struggling to breathe even while at rest, have low oxygen levels, which would be less than 88% on room air or on 4 liters of oxygen, have unrelieved chest pain, unclear thinking, or feel faint. At this point, you must seek medical care by calling 911 or going to the nearest emergency department. After an exacerbation, you should expect some lingering symptoms, including fatigue or weakness, cough, sputum production, wheezing, shortness of breath, and even chest pain associated with coughing. These should improve over the course of a few weeks. Continue medications and therapy as prescribed. Increase activity as tolerated. Rest when needed. Consider enrollment in pulmonary rehab to reach and maintain baseline function. Most importantly, you should always follow up with your pulmonary provider. For more information about pulmonary care for COPD, call 330-319-9700 or go to summahealth.org/COPD.